This is the last training session for 2023 and what is a year-long training collaboration between the Human Development Institute and UK Healthcare. But even though it's the last one for 2023, we still have 4 more to go in 2024. So that's exciting. And I think I say this every time since I'm fairly new to HDI as well. I have enjoyed these sessions because it's helping me get a better understanding of the resources that are out there and the connections that I can, people I can talk to. So it's been very helpful and I've enjoyed it. Just some housekeeping. We will record these sessions so we can share the links afterwards because I think that's very helpful. And also, if you have any questions, feel free to ask. And if you feel more comfortable doing it in the chat box, I'll keep an eye on the chat box and pass those on. So I get the honor today to introduce Walt Bauer. He is the pre-service training coordinator for the Human Development Institute, and he is going to be speaking today on Kentucky Disability Resources. So I'm just going to go ahead and turn it over to Walt. So thank you and welcome, Walt.
Thank you so much, Nancy. I appreciate the introduction. I am Walt Bauer, and I'm the pre-service training coordinator here at the Human Development Institute. We are glad you are here. My brief visual description is I am a white male wearing glasses with hazel eyes and a blue shirt with a gray and blue striped tie. My pronouns are he, him, his. I am sitting in front of a virtual background. My virtual background is a 3-story brick academic building that has offices for the Human Development Institute on the University of Kentucky campus. The topic is, as Nancy said, Kentucky Disability Resources, Services, and Supports that are currently available in the state of Kentucky and how to access resource information in a searchable online database. I'm going to highlight just a few of those services, supports, and resources available in our searchable online database. Please feel free to ask questions at any time. I'm going to share my screen and share a PowerPoint. I have the PowerPoint open on my computer, and I have just clicked share, and it may take just a moment. It says it's loading. And it looks like it has loaded. And if I go to slideshow and then I go to from beginning, it should go to the first slide, which it has. It should be able to advance the slides on my end, which I have. This first slide is Human Development Institute, University of Kentucky Human Development Institute's online Kentucky Disability Resources. I'm going to highlight a few of those resources in our searchable online database. This first resource is HDI Cats. I know Nancy is familiar with HDI Cats because Nancy does some work there at the front desk. Always a smile when I've walked into HDI Cats. HDI Cats, the Center for Assistive Technology Services. The mission of HDI Cats is to make assistive technology, also known as AT, information, devices, and services easily obtainable for people of any age or disability. This is in keeping with our vision to work toward enabling persons with disabilities to live independent lives in the communities of their choice with the necessary supports and services. HDI Cats does loan assistive technology and DME, durable medical equipment, to kids. There are lots of switch-adapted toys for kids at the HDI Cats Center. HDI Cats is located at 2358 Nicholasville Road, which is easily accessible on a bus route. So come and visit us at HDI Cats when you get an opportunity. Project Carrot. Project Carrot is a community outreach service learning program that aims to make assistive technology and durable medical equipment more accessible to those who need it in underserved areas of Kentucky. Project Carrot, as the second bullet says, has several locations across the state of Kentucky. Carrot stands for Coordinating and Assisting the Reuse of Assistive Technology. So that's the acronym CARET. coordinating and assisting the reuse of assistive technology. Project Carrot is a reutilization program completely free to the community members. The purpose is to repurpose or reutilize devices and not to buy new items. So Project Carrot also takes in donations, always looking for donations for wheelchairs and seating devices. We're always willing to take those donations, and those donations can be taken to HDI Cats on Nicholasville Road. So if you know of someone who has some durable medical equipment that they don't know what to do with, perhaps the person has had a temporary disability and no longer has that disability and has some assistive technology or durable medical equipment, you're not sure what to do with it, I would donate it to Project Carrot at HDI Cats. Um, Project Carrot, as I said, has several locations across the state of Kentucky. Project Carrot has a location in Thelma, Kentucky. Looks like we have a question. Go ahead.
Hi, in regards to being able to donate
Mhm.
like standers or anything like that to HDI cats, would you have to make an appointment or anything, or can you just show up?
You can just show up. You can just show up and donate that stander. Yeah, that would be awesome. Show
Thank
up
you.
anytime. Project Carrot has several locations. One is in Thelma, Kentucky. Thelma's a very small community in Kentucky. I've been there a number of times. They have a location at the Carl D. Perkins Training Center, which is just outside of Paintsville, Kentucky, in eastern Kentucky. And there is also another location in Hazard, Kentucky. And there's a location in the western part of the state in Owensboro, Kentucky. And of course, there is the location. Project Carrot is also located in Lexington, Kentucky at HDI Cats. I served as the program coordinator for Project Carrot quite a few years ago, right when it started, when we had some seed grant money available to start Project Carrot, and at that time, Project Carrot only provided assistive technology and durable medical equipment to those folks living in Appalachian, Eastern Kentucky, who did not have the ability to pay for durable medical equipment or didn't have health insurance. And this was before the Affordable Care Act. So there was a tremendous need for durable medical equipment and assistive technology because many folks did not have health insurance prior to the Affordable Care Act, which many do now. So I was the program coordinator for Project Carrot, and so I would be glad to assist you if you have any questions and make those connections. I know Nancy would be glad to do that as well. So any questions or you have about Project Carrot, I would be glad to assist. We have Independence Place. Independence Place is a center for independent living. There are centers for independent living across the state of Kentucky. The mission of Independence Place is to empower people with disabilities to live life to their fullest. Independence Place works alongside individuals of all ages and disabilities to teach skills that build towards self-directed achievement of independence and community inclusion. Independence Place provides independent living services. They provide information referral systems, individual advocacy, peer support and mentoring, independent living skills trainings, and transition. There is a Center for Independent Living in Louisville. The one in Lexington, of course, is called Independence Place that serves the Bluegrass area. But there is also a Center for Independent Living in Louisville. I have been there a couple times, a few times, and it's called CAL, C-A-L, and that acronym stands for Center for Accessible Living. It's in downtown Louisville, so I highly recommend the Center for Accessible Living in Louisville. Independence Place is located at HDI Cats, and HDI Cats is at 2358 Nicholasville Road. There is a organization that serves folks in Appalachian, Eastern Kentucky, and across the state. It's referred to as, the acronym is CARN, the Kentucky Appalachian Rural Rehabilitation Network. The Kentucky Appalachian Rural Rehabilitation Network is composed of people with spinal cord injury, stroke, and brain injury, healthcare providers, educators, researchers, and other community members committed to the health and well-being of people with neurological impairments who live in the Appalachian region. This community participation network has investigated and developed strategies to reduce disability and improve quality of life for individuals with disabilities living in underserved rural Appalachian counties. And this organization is focused on people living with disabilities in Appalachian Eastern Kentucky. So highly recommend this resource. And I am at one time attended their monthly meetings and know many of the members quite well. So many of them are friends of mine. So I would be happy to connect you to anyone in the Kentucky Appalachian Rural Rehabilitation Network. My email address is easy to remember. I hope it's my name. It's on the screen there, walt.bauer@uky.edu. So hopefully it's an easy one to remember, easy email address to remember. Kentucky also has an Office of Vocational Rehabilitation. The mission of the Kentucky Office of Vocational Rehabilitation is to empower Kentuckians with disabilities to maximize independence and economic security through competitive, integrated employment. There are rehabilitation counselors and rehabilitation technologists across the entire state, covering all 120 counties in the Commonwealth of Kentucky. Rehabilitation counselors and rehabilitation technologists determine what accommodations people with people with disabilities might need to succeed at work. Kentucky OVR also provides transition services. So adults with disabilities no longer qualify for the same care, services, and programs they did as children. For many young people with disabilities and their caregivers, the transition from childhood to adulthood can be a struggle, exacerbated by gaps in information and lack of support. So Kentucky Voc Rehab is filling in that gap with transition services, identifying and beginning helping students, young people, young adults, working with students before they graduate from high school. One way vocational rehabilitation does that is through pre-ETS. Pre-ETS stands for Pre-Employment Transition Services. Prepares youth for transition into adulthood, for college enrollment, or successful employment. And pre-ETS includes job exploration counseling, post-secondary counseling, self-advocacy instruction, work-based learning experiences such as paid and unpaid internships. We know those are important for young people, and workplace readiness training. The Kentucky also has stable accounts. Stable accounts are investment accounts available to eligible individuals with disabilities. These are tax-advantaged investment accounts for individuals with disabilities. They provide tax-free earnings at both the federal and state level, and assets in a stable account do not affect eligibility for federal or Kentucky means-tested benefit programs like SSI or Medicaid. So stable accounts are structurally like investment accounts in terms of tax advantages and investment options, but they have the transactional capabilities of a checking account. So prior to stable accounts, individuals could only save the asset cap or the asset limit of $2,000 of their own money before risking loss of healthcare and other benefits. So stable accounts enable individuals with disabilities to move from a monthly financial plan to a lifetime financial plan. Stable accounts are a savings vehicle for persons with disabilities. One of the benefits of stable accounts is they are owned by the individual with a disability, and they provide financial independence and financial literacy for people with disabilities. Any U.S. citizen who developed a qualifying disability prior to the age of 26 is eligible for a stable account. Individuals must have an email address. It costs $25 to open an account. Starting in the start of this year, 2020, January 2023, the federal gift tax exclusion increased from 16,000 to 17,000 annually, according to the IRS. And so the deposit limit for stable accounts is tied to that metric, so it will grow as well, and it grows with inflation, and most people would agree we've had some inflation this past year, so that metric will grow. The federal gift tax exclusion will grow to $18,000 next year, starting in 2024. So right now it's $17,000, but that will grow next year. The gift tax limit will grow to $18,000. If the account holder is employed, they may contribute up to an additional $13,590 of employment earnings to an account, bringing the total maximum yearly contribution limit for employed beneficiaries to $30,590 per account. There are 4 targeted risk funds from low risk to high risk offered through Vanguard, and there is one FDIC insured option, and those options can be chosen through are often selected based upon it's the individual with a disability selecting those options based on their time horizon and risk aversion. Money in the person's account can be used for everyday needs as well as unexpected events. Qualified expenses are geared toward improving health, independence, and quality of life, and include living expenses, education, housing, transportation, employment training and support, and assistive technology. Some people use stable accounts for long-term investments and do not spend out of the account often, while others use it as a very transactional account. I will say it is good news that President Biden in December is starting in January 1st of 2026 that the age limit for stable accounts will rise to 46 under a recently passed law. So that is good news. And that starts January 1st, 2026, because the current age is 26. And that is going to change at the start of 2026 to 46. I see there may be some comments in the chat. I've just clicked on that and see, I was checking to see if there are any questions. I don't think there are any questions at this time.
I think they are just all comments about Independence Place and no
Awesome.
questions.
Awesome. Thank you, Nancy.
Yeah.
Kentucky's early intervention system. Kentucky has an early intervention system, and it was formerly called First Steps. Kentucky's early intervention system is a statewide early intervention system that provides services to children with developmental disabilities from birth to age 3. So that's important to know, that this early childhood services, Kentucky early intervention system only goes from birth to age 3. It's formerly called First Steps, but it's now the Kentucky Early Intervention System. Providers deliver services that actively involve the family in visits, usually conducted where the child spends time, such as the home environment, childcare facilities, or at the playground. And the providers are speech therapists, occupational therapists, physical therapists. Developmental interventionists would be another example of a provider. They deliver those services that actively involve the family, where in the child's environment. I do know one family that received Kentucky early intervention services, and they had nothing but tremendous things. Phenomenal program. They provided therapeutic interventions for their daughter, such as speech therapy, occupational therapy, and physical therapy. And again, that is provided, those providers will go into the child's environment from birth to age 3. So highly recommend this as a resources for families that have a family member with a disability. Innovative supports for autistic workers, referred to as ISAW. The mission of ISAW is to support employers in their understanding of issues relevant to autism and employment. This is done through in-person trainings, online modules, and ongoing supports. ISAW works to increase employment for workers on the autism spectrum. All trainings and modules are being developed by Bev Harp. Bev Harp is the program director for ISAW. And the trainings and modules being developed by Bev Harp and Brittany Granville, a very talented artist whose understanding, both Bev and Brittany's understanding of autism, derives from personal experience as well as from peer-reviewed literature and experience gained through working with other autistic adults. So an important resource for autistic adults seeking employment. We have in the state of Kentucky a transportation initiative. The transportation initiative is a project of the University of Kentucky's Human Development Institute and is funded through the support of the Commonwealth Council on Developmental Disabilities. The Transportation Initiative seeks to provide comprehensive information and education on transportation options. We know that transportation is a challenge for Kentuckians with disabilities in our state. And so wanted to make sure to highlight this resource. Maria Kemplin is the project director. Know Maria well, so I'd be happy to connect you to Maria Kemplin if you have someone who is needing assistance with transportation in Kentucky. Kentucky Protection and Advocacy. The mission of Kentucky Protection and Advocacy is to protect and promote the rights of Kentuckians with disabilities through legally based individual and systemic advocacy and education. Kentucky Protection and Advocacy is the designated protection advocacy system for the state of Kentucky, also known as PNA. PNA, an independent state agency, protects and promotes the rights of Kentuckians with disabilities through information and referral, technical assistance, education, and training, and legal advocacy. Anyone with a disability-related issue or question can contact PNA, and I would be glad to connect anyone if they have a disability-related issue or question to connect them with PNA, Kentucky Protection and Advocacy. The Commonwealth Council on Developmental Disabilities. The Commonwealth Council on Developmental Disabilities, along with the Human Development Institute, HDI, and the Kentucky Protection and Advocacy, are part of our state's DD network, the Developmental Disabilities Network. And so the Commonwealth Council on Developmental Disabilities is a group of citizens appointed by the governor to serve as a leading catalyst for systems change for individuals and families living with developmental disabilities. The Commonwealth Council's emphasis is to be a source of information and advice in helping legislators and other policymakers to identify and evaluate the available alternatives for meeting the needs of individuals with developmental disabilities. I have a link to the searchable online database for Kentucky. I have just copied that link, and I'm going to put the link in the chat. And I've just pasted, I think that's going to work. The link to the online searchable database is in the chat. If I stop sharing and then I start to share again, we should be able to go to the actual searchable online database. I have it open on my computer. I have just clicked share. It may take, it says the screen is loading. I think it is loading now.
We can see it.
Thank you.
Yeah, this is
Trent,
cool.
yeah, if you click on transportation, the transportation icon, I just clicked on it. You can see my colleague and friend Maria Kemplin. There's the contact information. So these resources, each resource will have a contact information and then a website as well as a description of the resource. It's an easy way for you to, if you have someone who knows has a transportation challenge and needs some assistance, Maria Kemplin will reach out individually and help that person. If I click on the website, that will take us to the website. And here's the website for the Transportation Initiative. This is a valuable resource for Kentuckians with disabilities. And this is the place to go if you have a transportation challenge. So I've highlighted a few of the resources in the Kentucky Disability Online or Resource Guide, and you now have the link, and you can feel free to click on organizations and send people to our online Kentucky Disability Resource Guide. We may have a minute or two for questions. I would be happy to take any questions that you might have.
I had put a question in the chat. But
Sure.
does the Protection and Advocacy
Mhm.
Center, does that help with guardianship?
Absolutely, that would help with guardianship. You are right on. Yes, it definitely would. That would be the place to go if you have a question about
Okay.
guardianship. Camille Collins would be a colleague. She would be glad to help you, and I'd be glad to connect you to Camille as well. Be happy to.
That would be great. Thank you.
I'd be happy to. All of the resources that we highlighted, we highlighted in the PowerPoint, they are all in the searchable online database. So they are all there as well as many others, but I just wanted to highlight a few to let you be familiarize yourselves with some of the resources, important resources that we have in the searchable online database. Thank you all. It looks like our time is about up. Thank all of you for your time today, and have a great day and a wonderful rest of the day.
Thank you, Walt, for sharing such great resources. This
Thank
is
you.
fabulous.
Thank you.
Thank you, Walt.
Okay.
And I'm gonna say, please come visit us at CATS. That's my personal baby. I'm there twice a week, and we offer a lot of equipment and give away and lend out a lot of things that people don't know about us. So please come visit. And thank you, Walt. Thank
You're
you so
welcome.
much. Have a good rest of your day. See you next year, everybody.
Bye-bye.
Bye. Happy holidays,
Bye.
everybody.
Happy
Bye-bye.
holidays. Bye-bye.
Bye-bye.